Past 6 years has been hell.
Citizens of Flint still waiting for answers.
I've apologized for what's going on with the state, and I am responsible for state government.
But apologies are not enough.
What happened in Flint was criminal.
What's the price of justice for a city of nearly 100,000 people?
You can't put really a price tag on the lives that have been lost.
Everybody is talking to us. No one is listening.
Even if we don't understand exactly who knew what when, that is a well-earned mistrust.
I'm holding my breath, hoping that this is not a game.
After years of waiting, finally some movement.
There are no velvet ropes in our criminal justice system.
The former governor and 8 other officials charged, and a landmark settlement agreement, both met with mixed emotions.
It's a slap in the face.
It is some relief. They're finally getting charged.
Big Gretch and her girl needs to go back to the table.
Is $600 million enough? No, of course it's not.
An almost decade-long struggle for clean water that remains an unwelcome reality for everyone impacted.
I'm still standing in long lines every week just to get 4 or 5 cases of water for my family.
We got all these politicians running around. Do your job.
Which way will justice's scales tilt? And how do we move forward?
We have to demand better. We can never let this happen again.
Welcome to the Your Voice, Your Future Town Hall on the Flint Water Crisis here on Mid-Michigan Now. Tonight, we will take a look at where we stand right now with the criminal and civil cases surrounding the still ongoing crisis. Plus, we speak to leaders throughout the community and learn about the impact of the poisoned water on the residents, children, and adults, and what we can do going forward. One word that keeps coming up in our discussions and conversations with people in Flint is justice. And to be frank, the residents in Flint want to see former state officials involved in this crisis to go to jail. They want someone to be held accountable for the dozens of deaths linked to deadly Legionnaire's outbreak and for their irreparable harm the kids of Flint have suffered after being poisoned. The first criminal charges in connection to the crisis in April of 2016. Over the next couple of years, more than 15 people would be charged, but Attorney General Dana Nessel dismissed all charges in June of 2019. About 18 months later, in January of 2021, 9 defendants would be indicted by a one-man grand jury. Former Governor Rick Snyder and former Flint Department of Public Works Director Howard Croft have each been charged with 2 counts of willful neglect of duty. Additionally, 7 former state and local officials are charged with felonies. Former MDHHS Director Nick Lyon and former Chief Medical Executive Eden Wells have been charged with 9 counts of involuntary manslaughter in connection with the deadly Legionnaire's outbreak in the city. Former Senior Advisor to Snyder, Rich Baird, is charged with 4 felonies, including extortion and obstruction of justice. Darnell Early and Gerald Ambrose, both past emergency managers of Flint, are both charged with multiple counts of misconduct in office. Snyder's former Director of Communications, Jared Agan, is charged with perjury, and former MDHHS Early Childhood Health Section Manager Nancy Peeler faces 2 counts of misconduct in office and willful neglect of duty. In addition to the criminal charges, there is also a civil settlement. There are just days left for residents to sign up to be a part of a record-setting settlement of more than $640 million. We have a list of key dates you need to know about if you want to get involved in the settlement. Take a look. March 29th is the deadline for adults to opt in for the settlement. The 29th is also the deadline to file an objection to that settlement. On July 12th, those objections will be heard in front of a judge at a fairness hearing. Those involved in the suit will have until August 26th to submit the required documents to support their claims. I spoke with some of the lawyers involved on the civil side about what you need to know.
Once we get through the registration process, we then go into the claims period. And this is where individuals who have properly registered will have to make their claim. And there are about 27 different damage categories that people can make a claim. There will be a process, but the claims process as it currently stands will run from March 30th until August 26th. So we've got several months in there for people to work with their attorneys, work with us to develop the claims and to submit necessary documentation to support those claims.
So that you're saying everyone is different. So when it comes to a settlement, not everyone would be getting the same amount of money. Everyone's impacted differently, you're saying, and they would need to show how they were each individually impacted.
Correct. There are 27 different categories. Many of them deal with children, many of them deal with adults. But once the registration process is complete, then we're going to start talking to the community at large about the various damage categories.
I've heard some say, and you may have heard people say, well, I'm going to go at it at my own. I'm going to get my own attorney, not related to any of you. What are the advantages of doing it this way, the way with the class action?
Sure. Well, the litigation is over. You're not constantly fighting other attorneys who want to see your case dismissed. There are no appeals. We hope not. And once people register and submit their claims and their claim gets approved, they get their payment without further litigation, further hassle. If they decide to go it on their own, it's an adversarial process, and it's taken us 5 years, 6 years to get to this point. Believe me, there's been numerous appeals, and anybody who decides to go at this alone, they're going to face some stiff opposition from these defendants.
If someone does get involved in this, that means they can't sign up down the road for other suits, or they're tied to this, right? They can't be involved in multiple litigation along the way. That this is it, right? This is their legal action.
This is a partial settlement. The case is still continuing. You're still in litigation against the two engineering firms. So the case is not over, but if they participate in the settlement and they receive settlement funds, then their case against the city of Flint and the state of Michigan and Flint Hospital, that part is over. But we are still in active litigation.
What do many people, they're going to sign up, and everyone always asks, just like they do with the stimulus, what am I going to get from this? Financially, what can I get? And I guess your answer, you may have said it a little earlier without saying the number, it really depends on where you fall as in the damage, correct?
Correct. And it's a pool settlement, which means that individuals who fall into certain categories will share in the pool. And so the more people who participate in the pool, the smaller the awards are going to be. That's the way it's structured. So it's really almost impossible to predict what the final checks are going to look like.
You know, many people in this community, they've been through so much over the last years, and I'm sure many don't blame them, saying they'd like $1 million each for everything they've gone through, but that's just not the reality in something like this, correct?
I feel confident that we left no money on the table. We think we got everything that was to get in terms of getting the money for the people of Flint. And yes, what have I learned as a lawyer? Justice, when it usually comes in fractions, not in multiples. And unfortunately, that's true in this case, that people have to take less in order to get the matter closed. And you know, we're proud of the settlement, and we hope that people participate and join with their rest of the members of the community in trying to bring closure to this very unfortunate situation.
Because I know there's been some that are not happy with the attorney fees in this case. Is that finalized, or is that still up in the air?
The attorney fees petition has been filed. It's public record. The court will evaluate the petition. The court will hear objections from the community, and the court will decide what the attorney should receive.
Okay, so it's you yourself don't say, okay, X a number. It's the judge that you would say, absolutely, we want this, and then so it's a judge makes the decision.
Yeah, we've demonstrated to the judge the amount of work that we put in to bring this to a conclusion. I mean, it's important to know that we were at the settlement table with the state of Michigan, and they had an olive branch in one hand and a sword in the other hand. And while we were trying to negotiate a settlement, they were appealing every decision that Judge Levy was making.
Well, what if you are not happy with these terms of the settlement? You can contest the terms, but you must opt into the class action suit. We talked to attorney Brenda Williams, who explains what you need to do.
It's just a notification to the community that they have the right to voice their agreement, disagreement, objections to the water crisis settlement.
And what if they don't have any kind of objections? Do they still
Then don't feel, just, no, they don't. All they need to do is register to make sure their registration is submitted by the 29th, postmarked by the 29th of March.
For the latest information on the civil case, how to sign up, and more on the upcoming deadline, aim your phone's camera right now at the QR code that you see at the bottom of your screen, or head to the Flint Water Crisis section at midmichigannow.com. Coming up in just 2 minutes, how the Flint water crisis impacted water systems nationwide, plus a frank discussion of how race played a role in the poisoning of the water.
We now return to the Mid-Michigan Now Town Hall event, the Flint Water Crisis. Where are we now?
Welcome back to the Your Voice, Your Future Flint Water Crisis Town Hall. The water crisis in Flint brought a national and even international awareness of just how fragile our water infrastructure is. Stephanie Parkinson is in the studio with how this has impacted water systems around the country.
The water crisis is undoubtedly going to have long-lasting impacts in Flint, but it continues to spark change all across the nation. We're seeing more and more lead water lines being excavated, and we're now much closer to new, stricter laws being implemented for how much lead can legally be allowed in drinking water. Michigan is setting the bar pretty high. Starting January 1st, 2025, the legal limit for lead in drinking water will lower from the federal action level of 15 parts per billion down to 12 parts per billion. But already in the Mitten State, water suppliers are responsible now for replacing 5% of their lead service lines every year for the next 20 years. That mandate was put in place in January of 2021. And in the fall of 2020, the federal government also made some significant changes. While the federal action level for lead in drinking water will remain at 15 parts per billion, 10 parts per billion is now considered the trigger level. So what that means is communities must then implement corrosion control to try and limit the amount of lead in the water. This is a step many experts have said would have prevented Flint's water crisis. As we're seeing these changes, we're also seeing more lead water lines coming out of the ground. In September 2019 in Newark, New Jersey, the city mandated all lead service lines to be replaced in the city. As of January 1st, 16,577 have been replaced, and the city projects that they will finish the job of replacing all 18,720 by early spring, which would mark 2 years since they began the project. In Denver, Colorado, they started replacing lead water service lines in December 2019. Denver Water estimates they have 64,000 to 84,000 lines, and they plan to replace them over a 15-year period. In Pittsburgh, the Pittsburgh Water and Sewer Authority says more than 8,300 lead lines have been replaced since the summer of 2016, and said last summer the city has its lowest lead levels that they had on record in over 20 years. They were at just 5 parts per billion. These are just some of the many changes we've seen happen since Flint's lead water crisis. I'm Stephanie Parkinson reporting.
That Flint is a majority black city played a role in the water crisis. Mid-Michigan Now anchor Mike Woolfolk moderated a roundtable about race and the water crisis. A big theme of that discussion, loss of trust.
Well, as our look at the Flint water crisis continues, both at then and now, we turn to the impact that race has had on this situation and continues to have on many of the decisions that are made, the actions taken, and what is to come in the years to follow. Professor Peter Hammer joining us. He is director of the Damon J. Keith Center for Civil Rights and the Taubman Endowed Chair at the Wayne State University Law School in Detroit. Dr. Deborah Furr Holden with Michigan State University's College of Human Medicine, Division of Public Health. She's also on the newly formed Governor's Council on Health and Race. And then, of course, we have Frances Gilchrist, who is president of the Flint branch NAACP. Thank you all for being here today. Dr. Furr Holden, I'd like to begin with you. Census estimates peg Flint, and these estimates are from 2019, they peg Flint as a majority Black city, just over 54% of the population. From your perspective in the public health realm, what role do you feel race played in what we saw happen in Flint with the water?
Well, it's an unfortunate thing, but we typically don't see things like the Flint Water Crisis happen in what I describe as wealthier and whiter cities. It just doesn't happen. If you look at the places where these have happened, they have typically been in communities that were either economically disadvantaged. This happens a lot of times, often in rural communities and in urban centers where you've got a greater proportion of racial and ethnic minorities and people living at or below the poverty line. It makes us susceptible.
President Gilchrist, same question to you here, but from the civil rights standpoint, what role in your mind did race play in this water crisis?
It played a big, what it did is the NAACP has always had its eye on Michigan, Flint especially, because of the systemic racism that is ingrained in every piece of government. Really the water crisis started with the emergency manager law, which was disenfranchising a minority population. And the emergency manager law, as Deborah said, it was instituted in minority cities. When we were screaming, the water is bad, they said, forget you. The water's not bad. If someone in Dearborn Heights had said the water is bad, someone would have answered the call to see, but we were ignored.
And Professor Hammer, as we look at this from the legal standpoint, I see this as the civil aspect, which of course would involve the settlement. And then you have the criminal aspect as these cases work their way through court, dealing with who should be held accountable. So can you speak to how you see race having an impact on both of those?
Yeah, I mean, I wanted to say I agree with what the other panelists have said. The Michigan Department of Civil Rights did hearings on this, and I wrote an extensive written report framing it historically from a perspective of spatial structural racism. And each one of those words means specific things in a specific context. And I think people really need to be reminded on how much structural racism and our inability to understand the dynamics of spatial structural racism led to the Flint water crisis. I often say that if you properly understand municipal distress, you can start seeing it as archaeological evidence of spatial structural racism. And until unless we do, we will continue to have misleading policies like emergency management, like water shutoffs in Flint and Detroit. And if we don't start imagining new relationships institutionally, we're going to have additional crises in the future. But if you think specifically about the settlement agreement you're asking for in the criminal charges, I wrote an opinion piece for Bloomberg Legal that basically said I think that the settlement is probably the best that law can do, and recognizing that law is imperfect, and then making demands on the state legislature, right? So it shouldn't end with the settlement. The children of Flint are victims of state violence and should have a lifelong claim on a life cycle addressing their needs. So we should look at the settlement carefully. It's probably the best that law can do, but we shouldn't let our analysis and demands end at the settlement. We should continue to make demands on the legislature for the needs of those children through the course of their life. And then you look at the criminal charges, and it's way too little, and it's way too late. But it may be the best last chance we have to really get to answers to questions we don't know about. There still has not been the telling of the story that needs to be told on the financing of the KWA pipeline, the manipulation of rules that led to the bonding of that, the role that the governor, what did he know and when did he know it? And most likely a tragic cover-up of the Legionella disease, right? So there's so much that we know, but there's even more that we don't know. And I'm hopeful that this criminal process will let us get to more information that we haven't had access to really tell a complete story of what happened in the city of Flint.
On that level, we're already seeing how, for instance, former Governor Snyder's legal team is trying to have the trial moved to a different venue because they think any judge who would be in Flint or any potential juror who would be in Flint would already have their mind made up about the case. You could make the argument that there isn't a person in the United States, the entire country, that does not know what happened in Flint. So, you know, I'm not sure how far that argument really flies, but can an argument be made? And each of you can respond to this. We'll start with you, Professor Hammer, because it is kind of a legal question. Can an argument be made for even an attempt to move the trial or to make those types of claims is based on the racial makeup of the Flint area and where they would pull jurors from to hear this case? Would that be a factor in that?
Yeah. If you have enough money, you can find a lawyer that can make almost any argument you want. So yes and no. But I want to recenter your question on the basis of democracy. Few people kind of remember or understand that juries are a part of democracy, and they were always conceived of that way. So I think it would be the ultimate tragedy to have an emergency manager that displaced democracy be bookended with removing the jury from the city of Flint, which would be another denial of democracy. I think we need to trust our residents. We need to trust our residents of majority Black cities, and we need to believe that the people in the city of Flint are wise and just and should be entrusted to make this kind of decision.
The thing is that we as a community have had democracy circumvented that led to the water crisis. And it continues to be a snowball effect of how justice is meted. And it's not fair for you to say that you're so interested in moving the venue because you don't trust the people, but you didn't trust the people when you told them the water was fine. And the people are running a democracy. And if you don't trust the people, then you don't need to be included in the democracy. So why are the thresholds for justice different for you than for someone else?
I would love to just pick up on this notion of trust, because as a public health professional and somebody who's often asked, how do we restore and repair or rebuild trust in Flint? You know, trust is a funny thing, right? Trust is at the foundation of any good relationship. And I think the residents of Flint have valid mistrust of government, of systems, of institutions, of political leaders. That is a well-earned mistrust, because the reality of it is, even if we don't understand exactly who knew what when, what we do know is that when things were known, the Flint community was not given the truth. And so whenever people say that, I say, trust is something that takes time. It takes time, but it's not just time. It has to be time and then good behavior that goes towards restoring and repairing. So to now take a city that was lied to, a city that was poisoned, and say, and now we don't trust you, Flint, to honor democracy. We don't trust you, this place where this horrible event happened, to then be good stewards of this responsibility that all of us have. Jury duty and all of that is a civic responsibility that we all have. To now turn it around and say that we are the ones who are not worthy of trust to operate with democracy and goodwill is more injury and more insult and more assault on people who've already been traumatized.
We could sit and talk about this, I think, all night long, and we're kind of out of time at this point. But I want to thank all three of you for spending this time with us and with our viewers here at Mid-Michigan Now as we tackle this important issue, because it's not going away. We're 8 years into it, and as you've all said, We've got decades to go in dealing with this. Francis Gilchrist, Dr. Deborah Verholden, Professor Peter Hammer, thank you all for your time today.
Thank you for addressing this issue. Appreciate it.
To watch this entire roundtable, just point your phone's camera right now at the QR code that you see on the bottom of your screen, or head to the Flint Water Crisis section at midmichigannow.com. In 2 minutes, we take a look at an organization helping to identify children in Flint that need help due to the lead in the water, plus the surprising connection between birds, people, and the Flint water crisis. A new study on birds is shining a light on just how much damage lead exposure can create on the brain. Songbirds learn to communicate in much the same way people do. People learn to speak by listening to other people, and birds learn to sing by listening to other birds. Sadly, what the study shows is those birds didn't learn the same way after being exposed to lead-contaminated water. The Virginia Tech study was inspired by the Flint water crisis. The study used lead exposure levels from the crisis as markers to conduct their research when they exposed the songbirds to lead. This team of Virginia Tech researchers found the male songbirds with elevated lead levels produced poorer quality songs, struggled to attract mates, and had significant changes in their brains and central nervous systems. Professor Kendra Swole, one of the leads on the team, said she designed the study as a way to possibly help children who have already been exposed to lead. The next step for Swole and her team will be to collaborate with the Virginia Tech School of Neuroscience. Together, they will look at how lead interferes with the brain's growth. Also helping children is the Genesee Health System, a key part of helping children possibly affected by the lead in the water in the Neurodevelopment Center of Excellence. Mid-Michigan Now's Leah Kamenah takes a look at the program.
The NCE, located through these doors, offer assessments to children impacted by the Flint water crisis. Assessments done by highly trained, doctoral-level licensed neuropsychologists who study how learning and behavior relate to brain development and neural networks.
We really work with the child as well as the parents and the family to provide a complete and thorough assessment to help the parent really understand where the child may be struggling and also where their strengths are.
The assessments look into how a child problem solves, remembers information both in the short and long term, uses and understands language, learns and processes information visually and verbally in different ways.
There are a multitude of diagnoses that may be given after this assessment. We see a lot of learning disorders. We see autism. We see ADHD, as well as many other.
Birch says while they can't make a direct correlation between lead exposure and what they are seeing during assessments, they have seen an uptick in the need for their services.
We know which parts of the brain that lead impacts, and we know that the battery of testing that we do at NCE is designed to really assess those areas. And so when we see deficits in those areas, you know, we know that lead could have played a part in the diagnosis that the child is receiving.
Through the assessment, families are provided with a comprehensive list of recommendations and next steps.
It can be really shocking to hear things like, you know, your child has a learning disability or your child has autism, and we really want to make sure that we're supporting families through that process.
Next steps like educational and behavioral health and medical health care services.
We want to make sure that we are catching those things, because if not, it really just gets worse, right? School gets more challenging, situations in our life become more challenging.
There are Flint children and families inside right now receiving assessments and those next step services. Birch tells us she encourages all parents, whether you suspect something or not, to schedule an appointment. Head to our website, midmichigannow.com, to see if you are eligible for a free and Medicaid covered assessment. In Flint, Leah Kamenah, Mid-Michigan Now.
To learn more about the Neurodevelopmental Center of Excellence and how to sign your child up through the Flint Registry, head to the Flint Water Crisis section at midmichigannow.com, or point your camera right now or your smartphone at the QR code on your screen. In 2 minutes, we speak with the leaders from 3 community organizations in Flint about what they are doing to help residents as the water crisis continues. From the moment the water crisis started, our area's nonprofits have served as the boots on the ground. They passed out water and filters, helped local businesses with funds and families with housing. Nearly 7 years later, that work continues. Mid-Michigan Now's Kristen Lowe invited 3 nonprofit agencies to a roundtable discussion on their work so far and where we go from here.
I met with 3 nonprofit organizations who have been helping the community heal since the start of the water crisis. The panel included Glenn Wilson, President and CEO of Communities First Incorporated, Sue Peters, Vice President of Community Impact for the Community Foundation of Greater Flint, and Jamie Gaskin, CEO of the United Way of Genesee County. We sat down at the Coolidge Park Apartments where we discussed their work, their funding, and where we go from here.
What has your role been in the water crisis recovery so far, and what do you continue to do?
Well, Communities First is a local community development organization. We focus on 4 areas: affordable housing, economic development, and also we provide wraparound services for residents here in the city of Flint. Our role early on was to try to see what we could do to respond to the water crisis as fast as possible. So we ended up working with the Michigan State Housing Development Authority in the state of Michigan to immediately get out bottles of water and thousands of water filters to affordable housing developments, not only just ours, but actually in the entire community of Flint. Then we also work with the state to provide other services that might be needed for economic development for some small businesses, as far as some support there. So we work with the State Housing Development Authority to put projects of priority here in the city of Flint.
So we take a longer term goal and vision for helping after the water crisis. That's the role we played. We took in a number of funds, almost $40 million, 29 new funds, but I think the one that stands out the most is what we call the Flint Kids Fund. It was started by Dr. Mona. She challenged us, was the first donor to create the fund. And it's a $20 million fund. That's what we ended up bringing in, but really meant to meet the long-term needs of the children and families impacted by the water crisis. There are 4 strategies to that fund: education, early childhood and quality education, access to nutrition, family supports, and then helping access to medical homes to make sure our families had the connections they needed medically as they were responding to the water crisis. So the fund is still going. We have about $8 million to spend. But again, our role was really, working with our partners, but to really identify those long-term needs along those 4 strategies.
We worked as a partner with the state and the county and the city in the Emergency Operations Center on a daily basis. So we tried to do immediate needs issues. So for example, if folks remember, the Sheriff's Department started going door to door handing out water on one morning as soon as that declaration was made. I went to the truck rental place with the United Way credit card and rented all the trucks for the Sheriff's Department. We were paying to feed all the people initially that were coming in to volunteer and coordinating volunteers. So you have this phase where we're really working in partnership with that Emergency Operations Center. And then I would say where we are now, we're kind of in this recovery period.
What still needs to be done moving forward? I mean, we're several years into the recovery, but obviously the need is still there, and in a way, we don't even really understand all the long-term impacts. So from your perspective, what still needs to be done?
Yeah, so there are some real specific things that we need to continue to do, right? Ensure that children and families have a relationship with a primary care physician who understands the resources available to address those kids' needs, right? People need to stay connected because lead will express itself in folks' bodies over a long period of time. So we need to play the long game with making sure you have the medical side addressed. You also have an education piece that's very significant, where entities like the Flint Community Schools, but all the other school districts where these kids have landed in our intermediate school district are working together to ensure kids are screened and they can watch the developmental markers as they kind of move forward. So you've got kind of this health piece, you've got an education piece, but I think the piece that we need more than anything is a reestablishment of community trust, right? I think I can say pretty confidently that for the most part, most of the pipes have been changed, right? There's only a handful, I think another 1,000 or so that have to be changed. And we know our water system is incredibly highly monitored. We probably have the most monitored water system in the United States. So we know water in many cases is significantly better, but it doesn't matter how clean the water is if the families that live here don't trust that water is clean. So, even to this day, we're working with Nestle in partnership, and 3 semi-truckloads a week are coming into this city because we have a large portion of the population that still struggle to trust the water. So we're in this space where there are measurable things that need to be better, but there's also this sense of community trust, and that's going to take a lot longer time to really be able to address.
That's a very good point. Glenn, how do you think that community trust can be rebuilt?
So imagine right now, you have COVID and you have to wash your hands, or you have to be real clean, and you have people that have to stay indoors, and you have people who don't even trust their water. And so you think about those things. I mean, could you imagine thinking about that on a daily basis? You see what I'm saying? I can get poisoned leaving my house, or I can be poisoned in my
danger
home.
Inside, danger outside,
danger right? Everywhere. So could you imagine, some people don't even feel safe in their own homes, right? So it's until we as a community or as a government, until we're able to feel like we've been given restitution in a correct way that's equitable, that's true, I think that's the only place you're really going to see some reconciliation happen within our community. When I say restitution, that doesn't always have to just be when it comes to the stroke of the check, but the restitution is holding people accountable, doing what the government says they're going to do.
When it comes to funding, is money still available to you, and how much is left?
The specific fund that we created, the Flint Kids Fund, it was really a 20-year fund. The idea being that it would last throughout the time where we actually got a sense of how, children and families were impacted. So we did have that in mind, and we have about half of the fund. Jamie's on the committee, which is very helpful. We have a small group of committee members who help guide us, including Dr. Mona. We have about half. We're closing in on about $8 million. So we have some budgeting to do to make sure we last the 20 years, and we want to be very thoughtful and strategic about where the gaps and needs are and not replacing public money. At the same point, I would say we still have an opportunity to raise dollars for it.
We raised a total of about $8 million. About $3 million of that was from a very specific relationship with General Motors, quite frankly, and the UAW. The remaining dollars were from all parts of the world. Just like the Community Foundation experienced, we had from school kids and classrooms to actually inmates in jails to folks from around the world that contributed to that fund. And then those dollars were released directly to grantees, more than 100 different grantees across our community. So today, regarding that particular fund, we probably have about $13,000 left. Very, very little, because as the dollars come in, we spend those dollars.
Several years into the recovery, what are the needs now? Have they changed at all since the beginning?
Yeah, it's a tough question, right? Because it's really hard to pinpoint the true effects of the water crisis, especially on children and families. And then we had started thinking about it as a cohort approach. So thinking about those children who were 0 to 5 at the time, because they were probably the most impacted at that developmental level, where they could have been impacted cognitively with the effects of lead. Since then, though, we've I think, changed and shifted. So as a committee, we're thinking about it more broadly, because we know the trauma that could impact the family and beyond just that 0 to 5. We've shifted our strategy and kind of removed that age bracket, and that we're not just limiting it to that. So we're still looking at then more broadly, how do we serve the families? So even one of the supports is one of the strategies is family supports. And so and I think it still rings true, as you heard Glenn say, day to day, just getting through day to day is still a challenge for most families. And so I think broadening it that way and considering all of the dynamics and effects that families are dealing with, again, with COVID on top of it, is really where we've broadened, and we're trying to listen to the residents about their needs. I think the challenging piece was always trying to gauge where public dollars were going to come and where they weren't.
We got to move pass the dollars that are sort of raised, like we've done from charitable purposes, and more into this advocacy for change at the state and federal level around a couple different issues. I mean, not only did we have a lead and water crisis, we had a cost crisis. You know, water in Flint was more expensive than water in the middle of the desert, right? Las Vegas water cheaper than Flint water. That makes no sense, right? We've got to acknowledge water and access to water really as a right, as a public health requirement, and then we need to bring the cost of water into a space that allows people to contribute some to the cost of it, but doesn't penalize poor people, essentially, with really high water rates, right? So how can we create an equitable water rate structure in Michigan? And there are laws that need to be changed to allow those new ways of doing things to happen.
I think one of the greatest needs actually that has come out of all of this is this recognition that we need equity, right? And I think we're doubling down on that now. I think we learned from the water crisis. I don't know that the appetite to have that conversation, which can be uncomfortable, was there, right? I don't know that it was, but with the water crisis happening, I think we know we have to do it different so that we don't have another water crisis. Would that have happened it happened in a black and brown community? And would it have happened anywhere else? Probably not. That's the reality. So what can we do in having those honest conversations now to change how we are all working together and differently to make sure of equitable access to services? And so we've doubled down. We have some grant funding that we're working on around truth, racial healing, and transformation. I know we've been working with Jamie on, just making sure that we're approaching this, having conversations in the community, having some visioning sessions, but talking about how do we work differently moving forward to make sure that our community gets what it deserves.
I think certainly we're proud of the work that we've been able to do, but I would say we certainly feel like there's this huge gap between what we can do in philanthropy and what really needs to happen to bring equity to our community, right? And I think that part of the challenge is we have to look back in an honest way, and we have to say, the Flint water crisis was much more than a mistake or a flipping a switch to change to the Flint water, right? How did we get there? We got there from decades of not investing in a city and the infrastructure in a way we as a state should have invested more equitably, right? We got there because of the way we structure our housing in the community is not necessarily equitable for people of color, right? And then we got there because there was an emergency manager law that, quite frankly, was applied in a way that was not to the benefit of an equitable approach, right? I mean, and then the decision was made to sort of flip the switch to create the problem. So we've got a long history that if we can't come to grips with even discussing it, it's kind of hard to get to the solution that we want.
Think about COVID, like, I can't protect my family. That's the same feeling that everyone had when it came to water. It's like, okay, I got to turn off the water in my house or I can't use it, right? But could you imagine that thought process that someone would go through of, wow, my family was drinking, taking showers in this, brushing their teeth. How are my kids going to be impacted over the next, 5, 10, 15 years? Did something happen to them? And then if something did happen, right, that's a compounded, and then the COVID.
How are you going to figure it out?
Right, and then COVID happened, and like you said, you rip the Band-Aid off, and then now it's like when it rains, it pours.
For more on community resources available to you, as well as to see the entire roundtable, head to midmichigannow.com and go to the Flint Water Crisis section, or aim your camera on your phone right now at the QR code below on your screen. Coming up, how pipe replacement is going or not going. Plus, we show you how some Flint residents are dealing with the continuing crisis.
We now return to the Mid-Michigan Now Town Hall event, the Flint Water Crisis. Where are we now?
So where does Flint stand with the replacement of lead pipes? Stephanie Parkinson spoke with Flint Mayor Sheldon Neely about what remains to be done with the pipes, as well as the larger issue of the loss of trust that residents have in the system.
I want to just talk with you about where we are right now in the process of replacing the lead pipes in the city of Flint. This is something that we expected to be done in early 2020, just according to what was done in the court system.
The deadline was then, this project was woefully behind before I even took office. But right now, I'm glad to report we have less than 500 homes that still to be checked for lead service lines. And we're going to wrap this project up as soon as we can get back up and running this year.
Still complaints by residents about the water, whether it's just a lack of trust, but also issues with it. But naturally, as the city has warned and any community warns, when you start messing with the infrastructure underground to repair it and to replace it, it does disrupt the system. So how confident are you that when we're done with this final phase, that Flint won't be seeing any issues with their water anymore?
Well, the good indications are now that we're passing our testing by the EGLE and also EPA, the Environmental Protection Agencies, that we're required to do 6-month cycle testing. Flint now is reporting and passing those tests. And so we're looking at that as indications of a successful future. But now we have to work on the eroded trust, the crisis and confidence this community had to face over the last 6 years. And I understand, and it's justified. As a resident myself, we have to wonder, is it safe what's coming out of our taps? And so that's going to take some time.
Do you feel confident that after this last phase, all of the lead service lines will be gone? Because if we remember, back when this started, there was a lot of confusion about what was under the ground and a lot of note cards that were handwritten that was then being transferred into a map format.
Yeah, and as it relates to this, uncovered a lot of lack of attention to our infrastructure and our system, right? When we have age of technology, and we had handwritten documents. And so some of those documents now are being transcribed and being put into a computer database system now where we can move forward and track better what we have inside the ground.
Right now, the pipe replacement program at a standstill. The Flint City Council has yet to approve the money needed in order for the remaining lead pipes to get replaced. For weeks, Flint City Council has refused to make a decision on that funding. This week, once again, the City Council declining to take action, saying they will take up the issue next week. In the meantime, the lead pipes remain in the ground. The Flint water crisis continues to make life difficult for residents in the city. We talked with 2 people who echo a theme we've heard a lot this evening: the loss of trust in government. Mid-Michigan Now's Remy Murray shows us what they go through on a weekly basis just to get clean water.
7 years later, and 2 Flint women say they're still living their worst nightmare.
I feel the same way I felt 7 years ago. Now even more stressful.
It's just an ongoing, long process, and it feels like an ongoing torture.
Here you can see the inside of Melissa May's Flint home right at this very moment. But before she and her husband spent a lot of money to get to this point, it once looked like this from the damage the water caused.
We've been through 4 water heaters, 2 sets of washers and dryers. This is our 3rd dishwasher since 2014. The water ate through it.
And that's just the beginning of her problems. May still has to buy at least 10 cases of bottled water each week to support her family of 5. She even buys water for her plant because she watched them die from tap water.
Will you ever trust it? No, and the thing is people, they talk about it being a psychological issue. Well, of course. And as long as the plumbing and appliances in our houses are still corroded and damaged, our water is never going to be safe.
Gina Luster lives at an apartment complex in Flint, and she says it's the same struggle for her and her family.
I don't even trust the filter. I'm still standing in long lines every week just to get 4 or 5 cases of water for my family.
At one time, Luster says she and her daughter could build a fort with all the cases of bottled water. But now Luster says she's lucky if she can even find any water left at a site.
It's really a sad day when we're actually out and fiending for water.
Luster says she's blessed she can budget an extra $100 a month to buy at least 10 cases a week for her family. But she knows some people who aren't as fortunate.
There's people that literally go without water for days, and they're forced to drink that poison.
Something Luster says she won't ever do again.
Do you ever go back to trusting the water, even if things were to
No, I think every Flint resident is going to be suffering from PTSD when it comes to water. I don't trust the water here in this state or any other state.
Lester and Mays ask for people to not forget about Flint because the city is still broken and needs help. In Flint, Remy Murray, Mid-Michigan Now.
As this crisis enters its 7th year, we will keep pressing for answers. When will the pipes be replaced? What will happen with the youngest victims of the crisis? And what will come of the civil settlement in the end? Thank you for watching. It's Your Voice, Your Future on the Flint Water Crisis. You can re-watch this entire broadcast and complete versions of our roundtables by heading to midmichigannow.com. Have a good night.